If you're tired of sacroiliac joint pain and want fast, lasting relief, keep watching. In just 10 minutes a day at home with no special equipment, you can free yourself from SI joint pain without medications or expensive therapy. In this video, I'll show you 5 proven exercises that target your SI joint for immediate relief. These exercises not only ease your pain now, but also help prevent it from returning in the future. Plus, I'll explain common causes of SI joint pain and how to distinguish it from other lower back conditions. Make sure to watch until the end because missing any part of this video could be the reason why your SI joint pain persists and becomes a chronic problem down the road. Finally, I'll share the exact number of reps, sets, and how often to do these exercises to get the best results. Now let's get started. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas, and for over 15 years I've been helping patients overcome chronic lower back pain, sciatica, and neck pain, all without using medication, using very specific chiropractic corrective techniques. If you're busy with work or home life and dealing with chronic spinal conditions, this channel is dedicated to helping you. Here you'll find exercises, expert tips, and proven strategies aimed at managing and preventing back and neck pain so you can stay active and pain-free. Before we dive in, subscribe to my channel if you want more tips and strategies to help you achieving lasting relief, improve your mobility, and regain control of your life, all without relying on medications or surgery. In a moment, I'll guide you through a set of 5 exercises to stabilize the lower back and relieve SI joint pain. But first, let's talk about the most common causes of pain in the SI region. Number 1, a sacrum or pelvic misalignment. When the sacrum or pelvis shifts out of its normal alignment, it puts uneven stress on the SI joint, leading to pain and tenderness. As a chiropractor, this is by far the most common cause that I see in my office. Number 2, an anatomical short leg. A difference in leg length, even of just a few millimeters, can cause imbalanced pressure on the SI joints, which leads to chronic discomfort and irritation. Number 3, repetitive strain. Activities like prolonged sitting or frequent bending can strain the SI joint over time, which can cause inflammation and pain. Number 4, trauma. A direct impact or injury, such as a fall or an accident, can damage the SI joint and lead to persistent pain. Now, SI joint pain is characterized by a sharp or sometimes dull discomfort in the lower back or buttocks, and it can often travel down the same leg. It can be aggravated by activities such as sitting, standing, walking, or even climbing stairs. SI joint pain may also be accompanied by stiffness, reduced mobility, and tenderness along the SI joint. And while the pain is normally concentrated in the lower back and buttocks, it can sometimes radiate to the hip or to the groin. Next, let's discuss how SI pain can be distinguished from other causes of lower back pain. Number 1, a disc bulge or herniation. This type of pain will usually cause pain radiating down the leg along the path of a nerve. Pain is often sharp and worse when you bend over, which is different than an SI condition. Sciatica. This causes sharp shooting pain down the leg, while SI joint pain is usually more localized to the lower back and hips, and it won't follow a nerve path. Number 3, lumbar facet pain. This is usually a dull ache in the lower back, which is worse when you twist or you bend backwards, while SI joint pain will often refer pain to either the hips or the buttocks. Now that you understand the common causes of SI joint pain and how it differs from other conditions, let's move on to what you can do about it. I'm going to guide you through 5 simple exercises that will help stabilize your lower back and relieve SI joint pain. Let's get started. Okay, let's get started with your 5 exercises for sacroiliac joint pain. We're going to work on 3 stretches, and then we'll finish up with 2 strengthening exercises to work on core and lower back strength. So the first stretch we're going to work on is going to be the hamstring stretch. Now the hamstring attaches at the base of the pelvis, so when the hamstring gets tight, it can pull your pelvis out of position, which can lead to SI joint pain. For a lot of my patients that sit all day at work, they have really tight hamstrings, and I think this leads to a lot of their SI joint pain. So to easily stretch your hamstring, what we're going to do is we're going to sit on the edge of a couch or on a table with a straight leg. You can hang one leg off the couch, and all I want you to do is we're going to reach for your toe as far as you can and hold. What I don't want you to do is I don't want you bouncing like this because that puts a lot of pressure into the muscle. So just reach as far as you can towards your toe and hold it. And what you want to feel is a nice long stretch and the deep stretch into the back of your hamstring. And I want you to hold for a minimum of 30 seconds. and count nice and slow. 1, 2, 3. Again, a minimum of 30 seconds. Once you finish with one leg, you can switch to the other side. You always want to make sure you're stretching both sides evenly. So start with a 30-second stretch, gradually add up to a minute, 2 minutes a day, okay? Or 2 minutes per stretch, and do it at least once a day. You can do it either in the morning or in the afternoon, in the evenings, whatever time works best for you, but at least once a day, holding both sides for starting with 30 seconds, work your way up to 2 minutes. Okay, so that was the hamstring stretch. Our next stretch is going to be the glute stretch. So like the hamstring, the glute attaches at the pelvis. So when it becomes tight, it can pull the pelvis out of position and lead to SI joint pain. So to stretch your glutes, what we're going to do is we're going to sit, and you can sit in a chair, on a couch, anything like that. And we're going to form a figure 4. We're going to cross our leg like this. And then what we're going to do is gradually bend forward at the waist. And what you should feel here is a really deep stretch in that glute area, really along the back of that hip. Again, we're going to start holding for 30 seconds. Good, a nice slow 30-second count. Again, we want you to do this on both sides. Start with once a day. Gradually add more time. You can get up to about 2 minutes per day. Do it twice a day. Again, you're not going to overstretch. So start with 30 seconds, work your way up to 2 minutes. The last stretch we're going to focus on for SI joint pain is going to be the knee to chest. So for this one, we're going to lay on our back. So to perform the knee to chest stretch, I want you to lay on your back. You can lay on a yoga mat on the floor. You can lay on a couch or on a bed. Make sure you have your head resting on a pillow. I don't want your head kind of coming up here while you're doing your stretch. What we're going to do is we're going to lay on our back. We're going to pull one leg up, grab behind the knee, and I'm going to pull my knee towards the same side shoulder. Pull as far as I can and hold it. On this stretch, you'll feel some stretch in the hamstring, the glute, also the lower back. You might also feel some in the front of your thigh as well. Like the other two stretches, we'll hold for 30 seconds, then repeat on the opposite side, and then gradually work your way up to 2 minutes, and again, perform it at least once a day. The next two exercises we're going to focus on are going to be for strengthening the core and lower back to help with SI joint pain. So the first one we'll do is going to be a glute bridge. So for the glute bridge, again, we're going to lay on our back with our knees bent this time. And what we're going to do is I'm going to gradually lift my pelvis up into the air like this, really flexing my glute muscles, hold for 5 seconds, and then I'll come back down. And then we're going to repeat, come back up, hold for 5 seconds, and come back down. And I want you to start with 10 reps of this exercise, each time holding for 5 seconds, that you should feel some burn into the glutes. This is going to help strengthen the muscles around your pelvis, hold the SI joint in place. The final exercise we're going to do for your SI joint pain is called the bird dog. So for the bird dog, what we're going to do is we're going to be on your hands and knees. Make sure you keep a straight back here. And what we'll do is we're going to bring our right arm up and our left leg back. Hold for 3 seconds. Come back, kind of bring my knee to my elbow. And we're going to repeat. 1, 2, 3. Come back. And repeat. I want you to make sure you're keeping your abs and core very tight while you're doing this. You might feel a little bit of strain in your lower back. 1, 2, 3. Good. And again, we're going to do 10 reps of this. Repeat both sides, both arms. Now, just a disclaimer with any of these exercises, if you have any pain as you're doing the exercise, stop immediately. I don't want you to stretch through any pain. I don't want you to feel any pain as you're doing these, okay? By incorporating these exercises into your daily routine, you'll start building strength, improving stability, and relieving your SI joint pain over time. Keep practicing, and remember that consistency is a key for long-term relief. Now let me share with you 3 exercises you should avoid to prevent flare-ups, worsening symptoms, and long-term SI joint pain. Number 1 is running and jogging. Running and jogging are high-impact activities that can aggravate the SI joint by placing repetitive stress on the pelvis and lower back, which can lead to increased inflammation and pain. Instead, try using an elliptical, cycling, or swimming to get your cardio in. Number 2 is sit-ups. A full sit-up can cause strain on the lower back muscles, which puts pressure on the SI joints and can contribute to the pain. Instead of a full sit-up, try to perform a plank or even a modified plank to strengthen your abs. The last one is going to be weighted leg lifts. Things like squats and lunges place heavy loads on the pelvis and hips, which can increase stress on the SI joint and can lead to more inflammation and pain. Instead, try body weight lunges and wall squats instead of weighted squats and lunges. You now have a simple, effective routine to help manage and relieve your SI joint pain. By practicing these exercises regularly, you'll strengthen your lower back, improve stability, and reduce SI joint discomfort, which will give you more control over your pain and daily activities. If you found value in this video and got relief from the exercises, be sure to like and share it so others may benefit. Leave a comment below and let me know which exercise gave you the most relief. Was it the knee to chest stretch or maybe the bird dog? I'd love to know. And finally, don't forget to subscribe to my channel for more tips and strategies to help achieve lasting relief, improve mobility, and regain control of your life without relying on medication and surgery.